class, it's quiet time with the baby, so I can't speak that loud. I just finished at the job. I picked up a few things for Christmas. Spent a little bit under $40, around $38 and some change. 20% discount. I haven't done any Christmas shopping. I haven't bought cards or done anything, so at least I have enough stuff for all the ladies, little whatnots. I think I'm going to be going to look at loungewear and stuff. I buy stuff for my kids, and they tend to like it when I buy them loungewear. So I'm going to go look and see what Target, Walmart have. Not today, but yeah. I got my first paycheck from the retail job. It was around $140. It's not a lot of money. Basically, you get paid around 70, 80 bucks each time you work. So, but I've worked here a couple times. So they pay you every 2 weeks. So basically that was from my first 2 weeks of work, and I only worked one day. So yeah, I mean, it's okay. I'm not complaining. I look at it this way: I can make that small amount of money, or I could be at home thinking about, well, how am I going to make some money? I've applied for a lot of jobs that aren't in the nursing field, and I was looking at my email today. I got like 2 rejections. They always give you the typical, your qualifications are impressive. One of the applications, I didn't even finish the application, so really I don't count that one. But they kept saying to finish the application, and I never did when I looked at the job requirements. The other one is for health coach. I applied for it. I don't have a health coach certification. That's something I really want to look into, getting a certification like that, because there are so many openings for that. They have a class at Emory University. I saw one at Mayo, but since I live in the Atlanta area, I think I would prefer to do the one at Emory. Proximity and all. I have my YouTube collaboration tomorrow. Looking forward to that. All right. I had to get the map pulled up a little bit. Now I'm going to get let me look and see what time it is. I have to get some thumbnails while I'm in here, just in case. All right, hang on. All right. All right, so the collab is over. I'm going to go ahead and get out of here because it has been quite interesting coming over here. It's a very nice place, but I don't know that I would want to plan the class until after I see what it's like on Saturday. And because the class, the CPR class I'm gonna be doing at the co-work is gonna be next week, I don't have enough time to test out if this class is okay, if this location is okay on Saturdays. The parking is not great during the week. Only way I could see myself getting a parking space over here early in the morning is to be over here probably at 7 o'clock in the morning. But it's really cool in here. I mean, I think that it was a good experience. I went ahead and scheduled that CPR training for the 14th. Hang on. We got in a little bit into the discussion about this CEO of United Healthcare, all right? Let me talk a little bit about this recent event with this CEO that was unlived by somebody. I'm not going to get into that person's background or anything. I don't condone that. It's never right to unlife anyone. Looking at some of the comments in the comment sections, I'm not going to say that I was taken back, but I think people are tired, okay? Some of the comments, no one was offering condolences. They were talking about their experiences with healthcare denials. I always have to think about my professional brand in terms of what I say publicly. But what I'll say is, some years ago, there was this series on Netflix, and it talked about a pharmaceutical company that raised the prices on certain medications. This person for this healthcare company, I think that they were making, when you figure in all the bonuses and salary and everything, it was upwards of 10 to 25 million. When I was a public health nurse, there was this child that had this health condition. In California, it was California, there was this change in policy where people could select the companies, or certain companies were selected as the vendors. And these people started denying things. I eventually called the health insurance company and was advocating for this person. I had completely forgot about this. They came over and met with all the public health nurses and talked about the company. After I wrote them, they approved that child's medical stuff. Now, I'm dating myself. They offered to give us a free fax machine. Now, I know some people might not think that that was a big deal, but this was during the time when only certain people had fax machines. This was pre everybody walking around with cell phones and everything, okay? And my boss said, those people must really want for us to be quiet. So that's the part that I think about. People's claims getting denied. People having to pay sky-high insurance rates. I think between that and the recent changes in the election and the general, people are tired. That's what I would say. Again, condolences to that family of that CEO, to the wife. I don't know if there's children, but condolences to them. It was not right for that person to do that. There's nothing to justify that. But I wanted to give the additional perspective of my experiences. And some of the comments, I'll scroll them. A lot of the people, they have accounts not in their name. That person was going, really is relevant to stocks and everything. I almost looked at United Healthcare stock. I know you're thinking, how could you look at that? I looked at it. Not that I'm going to buy it, but that man was on his way to go to a shareholder meeting, probably to talk about how much money they've made from potentially denying people medical services. It looks like they have one of the highest denial rates, United Healthcare. I never have had United Healthcare, but I remember some people that had it when I worked for education system, talking about how much they had to go through to get referrals and stuff. I use a company where it's open access, and if you figure you need something, you just go straight to that person. You don't have to get a referral. Of course, it costs more, but Yeah, so I'm going to stop talking now because I need to get out of this co-working space before let me see what time it is. Okay. Yeah, I'm going to go ahead and get out of here. I need to go ahead and just go to my car because the parking around here is crazy. I think that this is probably going to end up being on the one where I have the W-2 jobs, because I think people are generally tired. You work and you get health insurance, whether you're paying it on your own or you have government assisted insurance. This is not good. And I'm thinking of kids that, when I worked, was a public health nurse. There was this kid that had like really bad, severe skin condition. And my God, it was horrible. I won't say the diagnosis. The baby came in for WIC services, and we were just about, people were like crying. The mama was crying. It was just, so anyway, she ended up, after this other nurse did a referral and called over to the dermatologist and said the child needed to be seen immediately because they were at risk of infection. If you don't have good skin, that's why when I had this stuff going on from the stress on this job, I was at a dermatologist. What if that was your child and you couldn't get the medication that your innocent child that didn't ask to be born have? So that's going to be it, guys. I'll talk to you later.